India's teenagers spot a record number of antidepressants and mood elevators in the past 12 months. It's the done thing, and it's all about breaking taboos. Mental therapy, coaching, and counseling have reached an all time high. Young people are owning up that they're depressed, stressed, or dealing with anxiety and panic attacks. Mood pills, antidepressant t shirts, counseling classes, panic busting clubs. They're all over the place. That young India is addressing matters of the mind finally should sound all good, right? That anxiety is no longer shrouded in stigma. Well, not quite. The surge in antidepressant use and cool mental health merge raises key questions. What's driving this surge in mental health issues? Academic pressure, social media, or deeper societal issues? Students as young as 7 are battling depression and anxiety. What are schools doing about this? And importantly, how did we reach here in the first place? What's going wrong with India's young? In today's episode of The Morning Brief, I talked to Geetika Kapoor, school psychologist and founder of community outreach platform at Essential, Aisha Syal, senior faculty and lead educator at St. Xavier's School, and my colleague and in-house health expert Tina Thakur on the subject. Tina and Vikas Tandikar, my colleagues who wrote that Gen Z is behind the surge in antidepressant pills, is what led to this episode.
So medicines are not the treatment, and I think there is much more that is needed to be done.
Here's what Geetika has to say.
Children who reach me are in primary, middle, and then high school. Some are in college and some have just started their careers right now.
But as Aisha points out,
bringing the whole thing into the curriculum wouldn't really help as a whole. We need to bring everything as a dialogue, to interact with the child. What are the problems the children are going through? How do they want it to be solved?
It's Thursday, the 22nd of February. I'm Ratna Bhushan from the Economic Times, and you're listening to The Morning Brief.
भारत के बच्चे खुश क्यों नहीं?
आज भारत में हर 4 में से एक बच्चा डिप्रेशन से गुजर रहा है। इसका रीजन क्या है और इसे जानने से हमें क्या फर्क पड़ता है?
Geetika, I'd like to begin with you. Are parents and families more supportive now of their teens seeking, mental well-being outside of their homes and families? I mean, is this only a big city phenomena or is it spilling over to smaller cities as well?
It is a mixed bag, I must say that. There are families who are much more alert and high on initiative when it comes to all sorts of needs that children are showing up, including mental health. And then there would be some families or systems which are more skeptical, who actually would also want, kind of center themselves as the main caretakers of the child. And they would want to be able to resolve. It's kind of a mixed bag of how many people would generally seek out help versus people who would want to solve it on their own.
So, how much younger are your patients now compared to, say, 2 years back?
The age group would be young in terms of 7 to 8-year-olds to start with, and then going up till 24, 23, 24 years of age. Children who reach me are in primary, middle, and then high school. Some are in college and some have just started their careers right now.
Wow, 7 to 8-year-olds. That's really young. What is the extent of the problems they're facing?
So the issues range from academic struggles in school, where they're finding it difficult to show mastery with whatever the curriculum is presenting to them. At the same time, when they go through prolonged struggles, there is emotional impact. Children also notice that they are lagging behind their peers. Moving forward from academics, then there are also adjustment struggles, because sometimes, when children are going from a family environment to a school environment, sometimes they find the culture of the school and the culture of the home being different. They find it difficult to relate to new people in the school. So some children take more time adjusting to the environment and the culture of the school, forming relationships. Sometimes children and youth would be struggling to form friends, form peer relationships that are more soothing and calming. Towards middle and high school, we see trends of comparison with the peer, one's own position in the social group. These are the questions of recognition, one's identity starts intensifying. And then there are, concerns about if someone feels not up to the group or being excluded, not being able to form satisfying social affiliations, recognition with the teachers, because that's another idea that, how the authority figures are looking at us. Am I able to create an impact on the larger school or not? Am I getting the recognition or not? Questions about future in the high school are very intensive, like where am I headed, what career am I moving towards. We know that marks become quite a big cornerstone of their struggle, because there's all sorts of uncertainty that starts trickling in. When I know that I may not meet the cutoff, I may not be able to clear a competitive exam, options that lie front of me, what will I do in future, where are my friends going to college, where will I go to college. A lot of times there is, clarity about what do I really want to become. I do not know. And all those are real looming questions for people who are in high school and in college. So issues are pretty wide.
Got it? Now let's talk about the remedy. One, of course, is counseling, which you, of course, do. The other is medication, antidepressants, pills, mood elevators. These are really selling a lot. So, who prescribes these? Where does the first step initiate? Is it the medication or the counseling which happens first?
When we say biological, we are saying that there is a biological component in terms of neurotransmitters, in terms of what is going on in the body, that is influencing the behavior and the emotions. Similarly, it is to do with the self, the individual, and the person, which is the psychological part. And then there is environment. There is family, there is school, there is society where somebody is participating. And all these influences, so we are saying biological, psychological, and social, all are influencing the person. So, generally, one remedy would not fulfill all. And when we start working in tandem with biological experts, with systemic levels of schools, other community services that we work with, the idea is to come from all angles, to be able to see where all the support is needed and what a particular child might be helped with. So we would want to take all the perspectives in mind and not kind of just say that only one perspective will be able to serve the child best.
Last year, an Australian review analysed the impact of exercise on mental health.
What we found was that basically any type of exercise is effective for improving our mental health.
That includes cardio, like bike riding, walking, swimming or running, while strength and resistance training was found to have the biggest impact on symptoms of depression. Mind and body exercises like Tai Chi and yoga were most effective at reducing anxiety. Generally, the more vigorous the exercise, the bigger the improvement in symptoms.
So, spotlight schools. That's where it's all starting. Aisha, you've been dealing with such matters for over 2 decades now. As an educator, it would be disturbing to see students as young as 7 battling depression and anxiety. I'd like to turn your attention to the root causes of the problem. Should dealing with mental health issues and social and academic peer pressures also be part of school curriculum? There's a lot of focus on physical health. There are gyms in schools, but mental health is not being given as much attention. I'd like your views on this.
Well, apart from complete academics and sports and the co-curricular activities, yes, this should definitely be included into the curriculum. And I think which is a part of the curriculum in the schools where the counselors are there. We have counseling sessions, special counseling sessions are there. If you have a dialogue with the students, a dialogue is mandatory in such cases. So only bringing the whole thing into the curriculum wouldn't really help as a whole. We need to bring everything as a dialogue, to interact with the child. What are the problems the children are going through? How do they want it to be solved?
Right. So we've talked about children. We've talked about the role of teachers. I'd like to draw your attention to parents. How proactive are parents? How involved are they? Because, in a lot of middle class houses, etc., these issues tend to be hushed up. Let's face it, people are hesitant to acknowledge or admit or address the problem. Should families be more supportive of such issues?
Yes, you are absolutely right, Satna. Parents are basically in a mode of denial when it comes to their children going through a lot of difficulties, mental health issues and all. And they are very apprehensive in coming forth to share with the class teacher or maybe with the school, maybe with the counselors. Here, the parents should come forth and discuss the major issues the child is facing. They are seeing signs. They are seeing the child being very sad, being very suppressed, being very alone, not kind of having a social behavior. They should come forward and approach the school for help because this is how the child can be saved.
Absolutely. But tell me, Aisha, in your experience, have you seen students also taking to medicines, having antidepressants, mood elevators, etc.? Have you seen that happening very frequently in, schools and environments you've been working closely with?
I haven't seen it as yet, but yes, the children do approach themselves. They approach the counselors themselves nowadays that, I have this and this issue, I have this and this trouble. Or if they, they go and confide in a teacher, like most of the children from the senior classes, they would come to me, Aisha ma'am, I have this and this trouble. If they have relationship, now this age is very prone to having a girlfriend or a boyfriend. So if it doesn't work out, so they do come to the teachers, they confide in, and but medication and all is something which I think even the children are not yet exposed to. They do not know there is something like an antidepressant. They know maybe either they, kind of they're wanting to deal with the situation, or if they are not able to deal with the situation, then maybe they go down to some kind of a very unfortunate extreme step.
India is the most depressed country in the world, followed by China and the US, as per a 2018 report by World Health Organization. WHO estimates that हर 1 लाख लोगों में करीब 21 लोग सुसाइड कर रहे हैं. In fact, we have the highest number of teenage suicides globally. The rate of student suicides have increased by 52% from what it was in 2007. India के करीब आधे corporate employees anxiety या depression के शिकार हैं. And the economic loss due to mental health conditions between 2012 and 2030, it is estimated to be $1.03 trillion.
But popping pills does seem to be the way out, stark as it appears. Easy availability? Yes. Regulation? Not much. Here's Tina with some stark ground realities and what's behind the skyrocketing sales of antidepressants and mood elevators, which India's young are triggering, and how pharmaceutical companies are responding to this phenomena. Tina, antidepressant sales are at an all-time high. What's going on there?
So, Ratna, we are seeing an increase every time. The numbers have gone up year to year. And the data that I had suggests that neuropsychiatry medicines are the top 10 therapies in the country. So, there's this health research firm, PharmaTran, they say that the sales of neuropsychiatry medicines, these are the medicines which are used to treat neurology and disorders related to central nervous system, have surged to over rupees 11,000 crore. This is also 6% of Indian pharmaceuticals market in calendar year 2023. So it is growing at the compounded annual rate of 9% from rupees 8,000 crore in 2019. So I think the point here to be noted is that we have seen a significant impact partly due to COVID, especially in the younger generation.
Absolutely. So tell me, Tina, what are the leading antidepressant drugs in India right now?
There's this drug called Nexito Plus from Sun Pharma, which contributes to 17% in this category. Then there is Stalopam Plus by Lupin. So it is a combination of two medicines which is used to treat anxiety disorders. This medicine works by increasing the level of chemical called serotonin in the brain. So basically, most of these medicines will improve mood, relieves anxiety, tension, and helps one sleep better.
So this leads me to my next question. How are pharma companies responding to this trend? Do we see a lot more companies getting into this segment now than ever before?
Neuroscience has become a big industry, and it is seen in the kind of sales the companies are witnessing over the years. The top 3 companies have sales of over like rupees 5,000 crore. And, mental health category is not like anti-infectives or flu drugs. The therapy is much more specialized. We have seen how depression has become such a big issue in countries like the US. And it's a, ticking time bomb. The companies, I feel, will continue to sell new products and formulations, but the remedy should be to adapt a wider approach to help burned out students which are preparing for exams, to getting the younger people happier. So medicines are not the treatment, and I think there is much more that is needed to be done.
Okay, I get it. What about pricing? How are such products priced? I mean, are they premium? Are they affordable? How is it working out?
There are a few which are under a national list of essential medicines, which means that their ceiling prices are fixed by the government. But not all are priced or fall under the ambit of NLEM. You'll also see that these are also available online. They are premium, they are affordable, they are accessible. But, the government, I don't think they can regulate like every product. So there is a range that you will see in this category.
Okay, talking about regulation, Tina, these antidepressants and mood elevators, etc., they're all available online. They're easily accessible. We don't know the side effects of these. They're, all over the counters. So, is there any age limit for people to buy such medication? Is there a lack of regulation? And if there is, should it be addressed? I'd like your views on this.
That debate has not happened, whether, there should be a capping, whether there should be a regulation in the pricing, or whether there should be a regulation in their accessibility. I think government at one point can add barriers or control them to prevent indiscriminate use, but they can't cap all products, or they can't, restrict their accessibility. So government, I don't see that discussion happening as of now. From their point of view, I think there are some initiatives that the government has taken so far, which include infusion of funds under their district mental health program. They have approved about 160 crore for states. And they have realized that COVID may have impacted the mental health of the people. So, we have now a 24/7 helpline to provide psycho-social support by mental health professionals for different target groups like children, adult, elderly, women, and healthcare workers. And I've also seen that the government has issued guidelines, advisories on management of mental health issues. And they're also providing affordable and accessible mental healthcare facilities to the population, including the poor and underprivileged. That is happening under the National Mental Health Program in the country. I think in addition to the above, the government is also taking steps to strengthen mental health care services at primary healthcare level. So these are the initiatives that I see that the government has taken. But, adding barriers to control use or indiscriminate use, I don't see anything coming as of now. They may do it, and how far they can do it, that only, time will tell.
Very significant points there, Tina. Finally, I'd like your views on this. What are the projections of this trend in your view? Do you see this momentum carrying on, even in the next few years?
Yes, the kind of pressures that these younger generation is in these days. This could be related to their competitive exams and whatnot. And I think this there's going to be a phenomenon growth in this sector, and we will see a lot of companies coming in. So we have basically the multinational companies and also the domestic manufacturers which are getting into, and I can see a lot of companies coming in, and this segment is going to go up.
A recent study by ICICI Lombard said Gen Zs and millennial Indians are far more prone to stress and anxiety than older generations. Some say they found it tough to transition from the world of education into the early stages of their careers. Others cite low academic life balance. Then there's the hustle culture, where younger people feel the constant need to prove themselves, all of which can manifest anxiety and low self-esteem. Another report by Kriya University red flags that some 51% of India's youth aged between 18 to 24 years have been struggling or distressed. The bright side is, while there's conflict, there's also a willingness to get help. Schools are stepping up, help is at hand, and pharma companies are in the teenage spotlight. But as the cliche goes, prevention is any day better than cure. And we hope we'll have a different story to tell on the issue next time around. We signing off on that note. You've been listening to The Morning Brief, and I'm your host Ratna Bhushan. This episode was produced by Sumit Pandey. Sound editor Amrit Reggie. Executive producers Anupriya Nair, Anirban Chaudhary, and Arijit Barman. The Morning Brief drops every Tuesday, Thursday, and Friday. Do tune in to ED Play for all audio content, including The Morning Brief. You can listen to our podcast on all major podcast streaming platforms. Thank you for listening and have a nice day ahead. All external sound clips used in this episode belong to their respective owners. Credits are mentioned in the description.